I'm Joe Gurri. I'm a general surgeon. I'm also Chief Operating Officer of MIMA. I've been with MIMA since, I think, 1995. I think the vision for this building came from our growth. We're a significantly growing multi-specialty clinic, a fairly unique group of doctors in our market. At the Gateway building, this facility here, 2,000 patients a day come through to see one of the 65 doctors or to have an imaging study or a laboratory test. So it's a significant traffic. When we decided to go forward with a building project, the first thing we had to do was find some land. Once we made that decision, having found the land, then we had to find somebody to help us build. We had made the decision for a design-build company. The advantage of design-build to us was that it was a unified responsibility. We had a fairly extensive interview process that involved us traveling to similar Cogdale facilities built elsewhere. We went to South Carolina and saw a few facilities there, and the discussion even had to do with going into buildings under construction and say, what are you going to do to make our rooms as soundproof as possible? So it was a very detailed thing, and it had a lot to do with what the design looked like, what the rooms were going to look like, even down to the details of decor. Overall, the reaction of the people that come in the building, whether to work or to clean it, or to repair it, or to staff it, or to get medical care within it, has been phenomenally positive. The Cogdale people were part and parcel of this, and we got to be quite good friends with many of them because we spent many nights talking about how big my drawer was going to be and where am I going to keep my otoscope. And these things were important to the individual practitioner, but it worked very well. It was a great process, and the result is that we have 125 doctors who are very happy with the facility, very proud of the facility, and universally think it is highly functional. As you enter the building centrally, we have a nice opening, beckoning area that is the entrance. We have a cafe that I think has been an enormous enhancement for both the people that work in the building and the people that are served by the building. We're extremely pleased with the functional concepts that Cogdale's design brought to us. The concept is to have a lot of services under one roof. Our most popular service is our laboratory, our blood drawing. If we were to add up all the compliments we receive from our patients, the lab is far ahead. Our imaging center here is, I think, key to the way we practice because we have pretty much a full imaging capacities except for some minor things that we do not have. But we do have MRI, we have CT scan, which is a 64 slice CT, which is capable of doing heart studies, every form of plain film radiology as well as ultrasonography is available. One of the important services that an experienced medical builder like Cogdale brings to us is their precise and exact knowledge. Our probably most satisfactory interaction with Cogdale as a design-build outfit was with our imaging center. Imaging centers are very specific. It requires a great deal of expertise and intimate knowledge of the imaging equipment, not the generic imaging equipment, but the individual model of the imaging thing, particularly in MRI. It requires a very in-depth knowledge of the equipment and how it's going to be used and how it's going to be placed. Cogdale's experience in this was totally satisfactory to us and resulted in an absolutely wonderful and very functional imaging center. After going through this process, I think I would define that the most important thing to make the design process work, the design build process work, is to have a very functional interaction between the building design company and the physician company. The Cogdell folks were great participants in this political process, and really I would say that when you're dealing with a company that has 100 owners, equal owners, very little is more important than managing this consensus process. And I think we chose a process that worked extremely well, and the results are wonderful. If you were an individual who was representing a medical practice and you were looking to build, and you came to ask me personally about my experience with Cogdell, I would wholeheartedly recommend this process and this company.